In recent years, cosmetic anti-aging procedures have gained mainstream acceptance. And while many women start with less invasive treatments like injections and fillers, at a certain point, some women consider facial rejuvenation surgery or a facelift for longer lasting and more dramatic results. Welcome to Health Talks. I'm Laura Termini, and my guest today is Dr. Alex Rosen, a dermatologist with the University of Miami Health System. And I'm very excited to be talking about this because beauty is one of my main themes in chickenol.com. Welcome, Alex. How are you?
I'm great. Thank you so much, Laura. I'm excited to be here and discuss all things skin rejuvenation, especially all that we have to offer here at the university.
Of course, in the era of social media where, I remember back when my mom was younger, I remember her friends talking about facial stuff or even going to the doctor to do some stuff. And it was very, very, intimate, and they didn't want to share with anybody. So now we have posts like this, comparing faces, all the doctors on social media. So let's start from the beginning. What is the appropriate age to start skin rejuvenation?
That's a great question and something that a lot of people ask all the time. And truly, it really depends on what patients are coming in for and what they're looking to treat. So for example, if a patient's coming in for acne or acne scarring, the earlier the better you treat something like that, the better outcomes the patient's going to have. So if a patient is coming in for acne, the first and most important thing that you want to do is get their acne under control. You do that with a combination of topicals, maybe oral medications. And then once their acne is under control, if they have things like what we call post-inflammatory hyperpigmentation, those dark spots you see, or even sometimes you'll see kind of acne scarring that look like small little holes or anything in the cheeks, then you want to treat those once the acne is under control. But the earlier the better. So age isn't really important in that. It's really just getting control of the acne first. Then there's this new term called pre-rejuvenation. And the concept of pre-rejuvenation is it's the idea of treating patients early enough on in their overall treatment approach that maybe further down the line, they don't necessarily need these major rejuvenative procedures. So what does this look like? For example, if a patient comes in and they ask, am I old enough to start Botox? Or neurotoxin. So when we say neurotoxin injections, we're referring to trade names such as Botox, Dysport, Xeomin, or Jeuveau. Those are the 4 FDA-approved neurotoxins on the market. And there's no age appropriate to start. What I do is I really evaluate the patient's muscle movement. So I have them make certain facial expressions, and I see if they have enough muscle movement or muscle activity where if they continue without neurotoxin injections, they might eventually form more deep-seated or it's what we call static wrinkles. So wrinkles that are there at rest without you even having to make a facial expression. So if patients have enough facial movement and enough muscle activity where you can see that slowly starting to form, then they might be a good candidate to do what we call low dose or baby Botox injections that are really low dose neurotoxin injections to really try to modulate the muscle movement rather than completely obliterate it. And then if patients are a little bit more mature, they've waited a little bit longer to start their rejuvenative process, there's really not an age that I tell patients that they're too old or too mature to start their procedures. If patients come in, it's really just a matter of, having the right expectations. They can't show me a photo of when they were 20 years old and expect that at 75, they're going to look that way. But I do have patients who are well into their 80s who are coming in for all different types of procedures, such as dermal fillers, such as neurotoxin injections, such as lasers. And I think that these are patients who might be a little bit more mature, but they don't feel as mature as their age, and they want to kind of look a little bit more refreshed.
Doctor, and I've seen more and more advances when it comes to non-surgical because, now we have a lot about the skin rejuvenation, also have the vertical lift. So it's like people don't know the difference. What's the difference between non-surgical and surgical procedures?
So when we talk about surgical procedures, you're really talking about Things like full facelifts, you're talking about lower face or neck lifts, you're talking about eyelid surgery such as blepharoplasty, and you're requiring things that oftentimes the patient needs to go under general anesthesia for. They're being done in the operating room. It requires a good amount of downtime as there might be a little bit of bruising or significant bruising in certain instances, things that require maybe sutures. And really patients who are going for surgical treatments are people who want very visible, immediate results, and they're willing to invest in those procedures because those procedures are going to cost upwards $5,000, $10,000, $15,000. That's not something that you're coming into an office and expecting to come out with, looking exactly like yourself. People want a change when they go in for a surgical procedure. Non-surgical procedures are an investment over time. It's not a one day in and out type procedure, one and done. Non-surgical treatments really require patients to have an understanding that this is a long-term investment, that the aging process continues over time, and patients are really investing in their long-term rejuvenation to keep their skin really looking as healthy and young as possible. And there's a whole gamut of procedures. There's, like we talked about, neurotoxins, there's fillers, there's simple things like chemical peels, there's laser resurfacing, there's lasers to target different pigments. So these are all part of the non-surgical rejuvenation process.
What's the latest in skin rejuvenation? Because the trends on social media about it, are they safe? What's your experience right now? Because I'm very afraid about people just posting on social media everything that they do with even people that are not doctors.
You mean on all the viral TikTok type things that are, you see all over the place?
Yes, yeah. And especially going to a place that is like like a beauty salon to do it. You know what I mean? Instead of you Miami with a doctor like you.
There's a lot of at-home procedures and trends that you see go viral on TikTok these days or Instagram, and it can be really alarming. I would say the most recent and most alarming thing that we've seen as board-certified dermatologists and plastic surgeons, probably in the past few months, was the Injectable Filler Pen, where patients can buy a preloaded filler pen and they can inject themselves in their lips or other parts of their face with an at-home filler. And as you can imagine, there have been a lot of reported complications from this. I mean, we go through years and years of training and surgical understanding of the anatomy to be able to perform these procedures safely and in the office under sterile conditions. And when patients are doing this at home following like a viral TikTok influencer, this can be incredibly dangerous. Other things that you've probably been seeing are these high frequency facials where patients are buying these like facial kits at home and using it to treat like acne. And we use radio frequency in the office all the time to treat things like acne scarring, but these patients are not doing it safely and they're causing heat burns on their skin and ending up with worse outcomes than what they started with. The one that got a lot of hype, especially over the past few months, was also the sunscreen contouring. So May is Skin Cancer Awareness Month, and a lot of dermatologists, including myself, have been very, active proponents of how to properly protect your skin from the sun using sunscreen, sun protective clothing. And then you have people who are using sunscreen either as highlighters on your face or to help contour. So they'll put sunscreen in areas where you would normally want highlight so that you can tan in areas where you would normally want contouring. And this is a major no-no. Leave sunscreen to sun protection, preventing skin cancer, which is the other thing that I do, skin cancer surgery, and leave makeup for facial contouring is what I tell my patients.
Thank you, doctor, for clarifying that, because I'm a beauty fan and I always go to doctors or you guys, Talking about because when I found out that you guys, of course I knew that you guys have the dermatology because I go there once a year because I got a skin cancer of my family, my grandma. So, and as you can see, I have a lot of dark spots and from the sun. And but on the other hand, I was like just thinking about the innovative treatments that you guys offer at University of Miami. And I wanted to talk about that and share it with my audience.
Yeah, for sure. I mean, I think the university has a lot to offer our patients in terms of skin rejuvenation, from basic things like I was saying to chemical peels, which are great for patients with active acne, skin pigmentation, even pre-cancers we use chemical peels for. We have non-ablative and ablative resurfacing lasers at the university, which can be used to stimulate collagen, get rid of fine lines and wrinkles, help with skin texture. We also have lasers that help with pigment and vascular treatments. So rosacea and what we call lentigines or sunspots are really, really common in South Florida from all of our sun exposure and heat. And so I pretty much do those types of lasers all day, everything.
This is driving me nuts, and I already Google it, and it's very difficult to get rid of it. Only with laser all around, so it can diminish the look of it. Oh my God, I hate it.
And then we have the injectables and the neurotoxins that we talked about. Then we have things like microneedling, and we do microneedling alone or in combination with something called platelet-rich plasma. So platelet-rich plasma, I'm sure you've heard, is where they pull blood from you. They spin it down to get what's called the platelet-rich plasma or the liquid gold. And that can be used as an injectable. It can be used on the surface of the skin while you're microneedling to improve collagen stimulation. It improves wound healing. So these patients who use the platelet-rich plasma with their microneedling treatments see really quick response times. Then we have a device that's radio frequency with microneedling. So this includes heat with the microneedles, and it can penetrate even deeper. It's safe in all skin types, so you can use it in our darker skin patients. And then we have things like Kybella, which you can inject to reduce fat, and it's approved for submental fat, but you can use it off-label in certain other areas. Things like thread lifts, where you're putting threads into certain parts of the face, under the eyes and the cheeks, to get like a mild facial lifting and contouring. And then even going back to neurotoxins, because we talked about it for muscle movement, but we also use neurotoxin injections to treat things like hyperhidrosis or increased sweating under the armpits or in the palms and the soles. And then we can use it for things like masseter hypertrophy for patients who clench a lot at night and they have really thickened or accentuated masseter muscles. You can use neurotoxins to treat there. And then most people think of just using botulinum toxin treatments for the upper face, but we can actually contour the whole face with neurotoxin injections. So a lot of things that are being done at the university, a lot of devices that are available all across our different offices, and a lot of things that we're doing. And I think what makes the university more unique is that we don't just kind of do what's being done in the other offices. We're using these devices to do clinical trials on scar rejuvenation. We're using it for laser-assisted drug delivery. So using it for patients who have really aggressive scars or really thickened scars called keloids, or we're even in talks about doing some sort of laser-assisted drug delivery for patients with really bad itching. So it's a really unique atmosphere where we can use our aesthetic and skin rejuvenative devices with our incredible medical dermatology colleagues as well.
So a person like me should go to you for my annual, because I always go once a year, where you guys always, the screen of my whole body. That's how I discovered that I had some spot that it had to be removed because there were pre-cancers, what's the name of it? It wasn't cancer, but it was something that they needed to be removed. So I go with you, and then you do my screening, and then if I can, that's my annual, and then I can have a treatment just tailored for me, right? About my anti-aging, procedures.
Yeah, it's a really good idea to come at least once a year for your skin check, like you said. And then, if a physician has time, you can do it in the same visit, but it's also nice to have a visit dedicated completely to your rejuvenative requests. So coming in knowing that you want to talk about things that you want to understand better, or different treatments you might be a good candidate for, the results you can expect, and I think that requires oftentimes its own 15 to 30 minute treatment visit. And then sometimes, depending on that, you might be able to get your first treatment that day or schedule your first treatment at a later date, depending on what it is that you're going to be doing.
Okay, thank you so much, doctor. We're going to be sharing this on social media and your contact info and the Department of Dermatology at Miami Health, so you can guys make an appointment and see what you want. I think, you know, the treatments, beauty for me is something that is not only about how you feel and how you see yourself in the mirror. It's about self-esteem and taking care of yourself from the inside out, and all the beauty treatments that we can do to feel better. Why not?
I agree completely. And we're here to make people look like themselves. We're not here to make patients look completely different. We're here to maintain the natural aesthetic that all of our patients have and just make them look a little refreshed and rejuvenated so that they do feel better. And we, you know, there's all these studies demonstrating that as patients begin to, you know, feel better about how they look, their self-esteem, their overall mood, and everything can improve with that too. So this isn't just about spending your money on aesthetic treatments. This is really about feeling better about yourself from the inside and out.
Doctor, I need a touch-up. I need my dark spots. I need a touch-up here. I need some filler. I need everything. So after the quarantine and everything that he's been going through, I'm like, I need help. So sign me up if you need a model or a partnership.
Sounds good. We will keep you in mind.
Okay.
But
Thank you, doctor.
Feel free to reach out, and it was really nice talking to you. And we're here to answer all your aesthetic questions.
I will. Thank you so much. Thank you, guys.
Okay. Take care.